Welcome, everyone. This is Nancy Anderson with SMI. I'm the Associate Executive Director, and we're really glad you're able to join us for today's program. I think you're going to gain some wonderful insights from our speakers. I've seen their deck and had a chance to talk to them about the material, and I think it's really exciting and impressive information to think about. As I've mentioned, all participants are on mute, and we will have time for questions during the program. So if you have questions, please feel free to put them in that Q&A box. And Brandi, if you want to put that slide up with the Q&A, just in case someone doesn't know. I think we're all getting pretty good at Zoom these days. And then we will answer your questions either in writing or verbally as we go through the presentation. But I'd like to introduce our speakers for today's program. We have the team from the advisory board who have done a great deal of research on supply chain and have some, as I mentioned, great insights to share with you today. Joining us today are Brandi Greenberg, the Vice President of Life Sciences and Healthcare Ecosystem Research for the advisory board company, Erin Lane, who is a Senior Consultant for Life Sciences and Healthcare in Ecosystem Research, and Nick Hula, who's the Research Analyst for Life Sciences and Healthcare within Ecosystem Research. So we're really excited that they were able to join us and share this information with us today. Thanks so much for being part of our group today, and we're looking forward to the program. So with that, I'm going to turn it over to our esteemed panel and look forward to learning a lot today about where supply chain's going. Thank you.
Thank you so much, Nancy, and thank you to everybody on the line today. We're really excited to be with you. I believe that many of you had an opportunity to hear from our colleague Ford Coles a few months ago about some of the macro trends that we are seeing in U.S. healthcare delivery. Today's session is a lot more focused to the world that you all live day in and day out. We have had the good fortune of really trying to dive in to understand how COVID really brought a lot of new attention to supply chain, and not so much to focus on the stuff that you guys have heard about and are living, but to try and think about where do we go next? What are those things that we want to make sure stay top of mind even when the pandemic moves forward, and what are some of the things that we can all be doing here and now? For those of you that I assume most of you are pretty familiar with Advisory Board. We are a research company headquartered in DC, and most of what we have historically done has really been focused very much on U.S. healthcare delivery. But the team that we have here today, we really work across the ecosystem, hence that ecosystem word in our titles. And so we spend a lot of time really trying to do a lot of what you all do within the work at SMI, try and help suppliers understand what it is that providers need and help providers understand what it is that suppliers are trying to bring to the table. And so we are just truly admirers of the work that you all do and the efforts that you put into kind of breaking down barriers and improving collaboration across the whole supply chain. And hopefully you'll see that mirrored in a lot of what we're going to talk about. Three parts to it, and we'll each take a part. The other thing that I just want to kind of make clear is a lot of what you may hear today may not actually be all that new if you are a supply chain executive. We are reflecting a lot of what we heard. We may have talked to many of you. Several of you filled out the survey that we're going to talk about. We know many of you have also brought colleagues today, maybe from finance or strategy or clinical sides. And we're hoping that this material gives you stuff to talk about and creates a better platform for dialogue about where we think supply chain needs to go. And so it's with that context that we want to begin today's session, and we will be breaking several times for questions. Frame this all just in the context of news that is new to, again, probably absolutely none of you, but really just the idea that supply chain brought so much front and center, but the press around supply chain back in March, April with that first surge was not necessarily good press. And the sense that COVID really exposed a lot of fissures and near breaking points in the supply chain, whether it was testing, whether it was about PPE, ventilators, and the like. But it really elevated the spotlight on supply chain and caused us to take a really good hard look, again, not just at the short term, but the medium to longer term opportunities. And so it's with that I actually want to turn it over to Erin, who's going to try and set some context about why we thought that this research was so important to do right now and the way that we went about it and some of the kind of framing insights. So Erin?
Thanks, Brandi. And again, thanks everybody for joining. So as we started looking, as Brandi mentioned, tons of headlines around what had happened with supply chain. And so we started looking at this issue and obviously wanted to get far beyond those headlines. So we wanted to understand first, what are the root causes of these shortages or potential shortages? We also wanted to take a holistic approach to this research. So the supply chain is, of course, very complex. It stretches across the globe. So that means that interconnectivity in turn means challenges that trickle into one another. So we wanted to explore those relationships with one another as well. So our first finding, which will probably not be new to anyone on this call, but I think is still pretty important for us to recognize, is that the system that we have designed is designed primarily for efficiency rather than resiliency. So when conditions were stable, many parts of our supply chain were pretty efficient. So for example, it's most efficient to concentrate production and assembly into certain parts of the world. We also had many manufacturers that rely on the same sources upstream for raw materials or component parts. And as we moved downstream, purchasers were practicing that just-in-time inventory management, sole sourcing, or narrow sourcing to kind of minimize that per unit cost. But when conditions changed and so our demand became much more unpredictable, the system didn't have any slack and therefore it couldn't easily adapt to all those challenges. So that was what we first noticed. But then we also saw that the challenges went a little bit deeper. So as we continued on with our research, what we noticed didn't get as much coverage in the press was the obscured visibility across the supply chain, which is what we've tried to call out here on this slide. So at each step in the process, trading partners don't necessarily know where things come from, where products largely are as they move across the chain. Purchasers struggle to keep up with some of those regulatory changes and approvals. So that means they can't always find those new or qualified suppliers when they need more. This was obviously a huge issue back in March and April, especially. And at the same time, health systems don't necessarily have easy ways of knowing what they even have inside their own system, again, compounding some of those challenges we see upstream. So at each stage in the process, this lack of visibility hinders our kind of collective ability to learn, to respond, and to adapt to make this more efficient supply chain. So our second big insight is on the next slide. And as we continued on with this research, we realized that this supply chain that we all think of as so incredibly efficient actually wasn't particularly efficient. So that means we didn't even have the flexibility that we needed to adapt, but at the same time, we still had plenty of inefficiencies. So a couple of quick examples, which I'm sure some of you can probably think of similars at your organization. So for example, the need for rush shipping on supplies due to low inventory levels at provider sites, or maybe supplies expiring on shelves before they can get used. So these are two just quick examples about what's actually missing in the supply chain, and that is visibility. So a more resilient supply chain is probably going to require some investments. We certainly know that in contingency planning, in more duplication. But what I really want to caution you against is the assumption that making gains in efficiency or resiliency is going to require an equal trade-off from one another. And again, what our research team argues and what we continue to find time and again is that increased visibility can actually unlock these opportunities to both reduce waste and increase flexibility at the same time. Again, this could be as simple as reducing those overnight shipping costs thanks to more accurate demand planning, so you being able to see what do you have internally and tell your partners upstream. Or it could be something much, much more complex, like blockchain trading platforms. But overall, we found that transparency changes the rules and forces us to think differently about some of these trade-offs that maybe we have taken as fact that might not necessarily always be true. So not exactly the easiest challenges to resolve when we lay it out like that. And in order to really rethink that paradigm between efficiency and resiliency, we need to think totally differently about supply chain. And in order to think differently about supply chain, especially at health systems, that means that supply chain needs to be much more than just procurement. That means supply chain needs to really be a strategic partner to executives to plan for the future and to get us kind of out of the situation that we're in right now. So we have data here from a recent survey of health system purchasing executives, which again, many of you all took, or at least saw some of the information about this. And Nick is going to be sharing a lot more about these insights. But you can see on the left, so we asked participants to identify the executives that they thought were most critical to engage if they were going to truly change kind of how supply chain functions at their health system. So you can see the top four here. We have finance executives, CEOs, the chief medical officer, and also service line leaders. And pretty promising that we've been hearing from our interviews, again, with some of you on the line, seeing some familiar names, that supply chain leaders are getting invited into the room with executives more and more often, as you can also see from the quote we have in the bottom left here. But it is about much more than just having a seat at the table. Not only do supply chain leaders need to have a seat at the table, but their priorities need to be taken seriously and given value as well. And for the first time in quite some time, we're actually seeing that occur. So this data on the right here is showing where leaders are telling us their supply chain priorities are. And you can see that nearly half of all respondents said that supply chain is a top 5 priority, with about a third telling us it's a top 3rd priority. So bottom line here is supply chain is finally getting the attention that's going to be required to become a strategic capability for organizations. So moving on to the next slide, we know that we have a problem. We know that those problems are interconnected and related. We know that health system executives are paying attention. The industry as a whole, honestly, is really paying attention to supply chain. But then the question becomes, what do we do with all of this? Well, there are 2 responses and 2 tactics that keep coming up, particularly at the organization level, but also at the state and federal government level. So first, buy American. Let's become less dependent on China, on India, on other foreign suppliers. So that means build and buy more domestic manufactured products. And then second, let's increase inventory par levels and continue to stockpile. So these 2 tactics aren't necessarily wrong. However, they're far from a silver bullet that I think a lot of people think of them as. And importantly, they don't address that underlying challenge of visibility that we've been talking about. And at the same time, they're a bit more of that survivalistic over strategic. So when confronted with ambiguity and threats, we kind of have human behavior and we look for things that we can control ourselves. Both of these approaches do solve a piece of the larger problem, but I think it's important as we go down these roads to also think about some of the ripple effects and some of the additional challenges that they may create. So for example, on the left, buying American. It does reduce our dependency on other countries, especially if there is some sort of trade issue between our country and theirs. But it doesn't necessarily guarantee any level of adequate supplies, particularly in times of crisis. And there's really no quick solution here. So I'm sure a lot of the suppliers and manufacturers on the line can tell you this. Building up this required capacity in the States is going to take some time. And then second, on the increasing stockpiles. This does offer some quick solutions and some good solutions now. But I want you to consider what happens if every organization does this. So it always makes me think of the very beginning of the pandemic, and honestly right now, where we're again seeing a run on toilet paper. So everyone's running out and getting more and more toilet paper. And so that means that we have less and less toilet paper in the stores. So whenever you see it, you try to gobble up more. So even if you think beyond this me first mentality, it pushes the health system's role. All of a sudden, you have all of this excess inventory, and you're asking health systems to manage inventory levels that they've never managed before, and kind of getting outside of their core competencies and capabilities with inventory management. This also hinders some of our partners, like suppliers and distributors, ability to really leverage scale. And the health system is really just too interdependent to kind of move down this siloed approach to inventory management. And again, I want to emphasize, unless we can hardwire transparency into the system, we're just going to continue ending up with supply chain roadblocks, maybe in different places, but continue to run into roadblocks. And finally, that brings us to what we think. So what are we telling organizations based on our research, on conversations with you, based on the data that we're receiving, where we think that you should go next in order to realize that promise of a more modern, efficient, and really resilient supply chain? So first, we have a few foundational imperatives. So on the far left, we have what can you be doing internally? It doesn't matter if you're a supplier or a provider. We think that any trading partner can be doing these things internally. To the far right, how do we need to transform the entire industry? So first, supply chain, again, needs to become more strategic. I'm sure that you're starting to hear a lot of the words that we're continuing to use time and again, but we really think that the supply chain leaders need to demonstrate their ability to be strategic and to be strategic partners. Second, investing in capabilities that allow for more adaptive demand planning. So knowing what you have and what you may need in the future. So those two are non-negotiables, but you can then take the challenge of building out a more modern and resilient supply chain function. So next we have integrated inventory management that encourages this cross-sector transparency that we really haven't had before. And then finally, all of that can be bolstered by friction-free or at least lower friction collaboration. There are also some underlying elements which might not be written out on this slide, but we think themselves are also really important pieces of each one of these initiatives. And that includes executive support and buy-in, clinical integration. So something we haven't talked about yet, but we'll discuss a bit later. So clinical integration, particularly at provider facilities, both during and after purchasing. And then finally, analytics across the board. We think this is a huge opportunity for new types of analytics and new uses of data in order to enable us to have faster, smarter decision making. And so that is where we want to go and where we really want to spend the rest of our time. Before we move on, do want to pause briefly for questions before then jumping in and talking a little bit more from Nick to hear about what we've learned in our survey.
And at this time, Erin, I am not seeing any open questions, but we will give folks a minute if they want to type any into the question section. Otherwise, again, if you guys think of questions, put them in and we'll get to them when we can. We are going to break a few times to try and make this as interactive as possible. So we do have one question that is a little bit about what friction-free really looks like. We will get to that one. What we're going to do is talk a little bit about the survey, which is what Nick's going to do next, and then we'll come back and I will go into each of those 5 themes in a little bit more detail, where we can hopefully give you a feel and a flavor of where we're starting to see, if it's not friction-free, at least lower friction than where we have seen it before. And with that, we will keep monitoring these questions, but for the sake of time, we're going to turn it over to Nick to talk a little bit more about kind of the here and now based on a survey that we did that Erin's mentioned that many of you kindly filled out.
Yeah, thanks, Brandi. I think that, when we set out to do this survey, obviously we all know that COVID-19 has really drastically changed how all of our supply chains operate. But I think it's important to really take a step back, recognize how supply chain purchasing and investment priorities are really changing with COVID-19 in mind. And only by doing this can we really understand how and really if a lot of these lessons that we all learned during COVID-19 can translate into those long-term supply chain priority shifts in an, eventually a post-COVID world. So again, to answer a lot of those questions, we did complete a survey of health system leaders. Thank you, anyone on the line who did complete that survey. Again, seeing some familiar names people we've spoken to on the line here. As a high-level overview for this survey, about 75% were supply chain leaders, good representation in finance, operations, and clinical and strategy leaders as well, and about half and half between that VP C-suite level and that director managerial level. Again, just want to mention for background, not on the slide, but we had health systems answer this from across the country, be that the big 100+ hospital health systems down to small systems or even standalone community hospitals. So if we take a look at the next slide here, one of the biggest takeaways from the survey was that COVID, really unsurprisingly caused a lot of leaders to radically reprioritize and think about how they do their work. So to orient you to what you're seeing here, the dark gray bars above each priority are the percentage of the respondents that said this is a top 3 supply chain goal in a pre-COVID world. So think about like 2019, their strategic plans moving forward. The light gray bar are how that changed post-COVID. They're the percent of respondents who said this is a big priority now. As expected, the need to mitigate supply chain risk shot up dramatically. I don't see that going down anytime soon. But the other big one that really shot up was kind of this desire for more strategic partnerships between providers and suppliers. I think this just generally speaks to recognition of interdependencies in the space. But dropping in importance, if you look at these black dotted boxes here, pretty interesting. So standardizing product use, standardization, that drop, it's still the top priority, but it did take a hit. Otherwise, a lot of these efforts around like value analysis, engaging clinicians in product purchasing, improving clinician contract compliance, those really did drop quite a bit, which is obviously surprising. We all know that clinician relationships are vital to your success as supply chain leaders. But I think this emphasizes that tough position that supply chains are in right now. There's a lot of focus on them, and there's simply not enough time in the day to do everything. So some initiatives definitely have to take that back seat. Other reasons for this drop could just be because supply chain leaders have made a lot of gains in this space, and they're looking for new challenges to tackle, just as some great new challenges arise. Could also be because of the financial pressures and risk mitigation now requiring financial and supply chain leaders to dictate the terms to positions a little bit more directly. Jury's still out. Those are the ones I'm watching for. But what I really want to dive into over the next couple slides is this priority that spiked the most. So what does it actually mean to mitigate supply chain risk? As that's the biggest change we've seen in the past couple years. As it turns out, most of our survey participants thought about risk as an external threat, something that they have to manage. So big concerns we see on the left here. Products sourced or made in very few places, no way to monitor hazards or political or natural disasters, inflexibility of allocation models. In contrast, very few people acknowledging a lot of these risks closer to home on the right here as top threats. So for example, 60% of respondents said a lack of upstream visibility is a threat. Only 6% said a lack of downstream or internal visibility is at the same level of threat. The same goes for sole sourcing, as you can see in the bottom right. I think our team thinks that this comes a lot down to human nature, honestly. Kind of we fear what we can't control, but it does give that interesting insight that everyone does just want more control over their supply chains. And this isn't just, providers saying this about suppliers. We're also hearing from suppliers a similar story. So for example, suppliers could make more informed upstream purchasing decisions if providers could more reliably predict and communicate their product demand or usage to them. But none of this is really about pointing fingers or anything. One entity can't and really won't completely erase risk. But I think this results just underscore that challenge we're all up against. But in response to this fear, we want to know kind of where the industry is planning to put their dollars as they think about investing in supply chain. Really, what investments can help them make or mitigate some of that risk. Now, you're on the right slide, Brandi. In a stat that should be known at this point, folks are going to invest in stockpiles. Most of you are doing this. Kind of orient you to what you're seeing here. We did test kind of like changes in terms of purchasing or ways that folks manage their supply chain by product category. You'll see just 2 changes here on the left. We tested about 6 more, but just for the purpose of today, we've included these 2. And you can see how those break down by product category going vertically. So left side of the screen here, 80% of folks are stockpiling PPE, significant amount are stockpiling some other critical products. And on the right, you can see just under 75% say those stockpiles are an essential part of their supply chain success. No surprises there. But if we look at the second column here on the left, at the surface, this interest to manage inventory is a bit less volatile by product category. And if you dive a bit deeper, you notice something pretty interesting. Take a look at the two stats here on the bottom right. These point to just a growing desire by the survey respondents for investment in analytics and platforms that can help with that inventory management, largely by either increasing visibility, as we were talking about before, or by demand forecasting. So, and here's the important part that kind of ties all these numbers together, because I know there's a lot of numbers on the slide. As we all think about mitigating risk, while the overwhelming instinct to stockpile, there's roughly half of participants that seem to understand what I believe to be true and what non-supply chain leaders need to recognize, is that stockpiling without the accompanying analytics will not help us mitigate supply chain risks nearly as much as we hope. As Erin was saying before, we need those analytics in place to really get the most out of this. And we will see more of that importance of analytics throughout the next few slides as well, as we dive through each one of those 5 aspects that Erin laid out before. So I will pause here, open to, again, any questions that you all may have, either about the survey results or about any insights that we've found thus far, before turning it over to Brandi to kind of dive into each one of those 5 aspects.
So I do see a question. We've got basically, what are our thoughts about how far it seems that providers are trying to get into the business of manufacturers asking for all that upstream information? It says we write contracts to provide supply assurance, incentives can be aligned. Should providers just be focused on holding suppliers accountable and raising the level of transparency around where the risks are versus wanting to get? So I think the question is kind of, and Nick, I'll have you start with, like, what are our thoughts about kind of how much information is disclosed versus just having assurances in contracts? And whoever typed that, it's a great question. And hopefully we'll try and share some thoughts, but I think this is an ongoing hot topic. Nick, what are your thoughts?
Yeah, absolutely. I think this is something we're hearing a ton about from providers and a ton about from suppliers as well. And I think at least from the provider angle, obviously, like we said before, there's just a lot of, they get a lot of fear when looking at their upstream supply chain, because that's something that they cannot control. And I think control is the one word we keep hearing again and again and again in conversation with supply chain leaders. They're putting everything in place that is within their powers to kind of mitigate a lot of this risk, but they still see their suppliers' risk as their own risk. So I think a lot of this request for more and more information about where this manufacturing coming from, where do your raw materials come from, that's a symptom of folks just wanting to have that more control over their upstream supply chain. I think that there's an extent to which suppliers can provide some information, be that within the contracting phase, or just kind of relationship management, whether looking at annual reviews of those relationships. But I think a lot of times that thing what providers need to understand is that a lot of times suppliers actually don't have a ton of insight into their upstream supply chain as well. They may know where they get their component parts, or where that kind of second level, 2 levels above them come from. But a lot of times they're a bit in the dark in terms of where their raw materials come from as well. And I think that we need the industry to realize how much transparency is it efficient or possible to share with each other, and really figure out who are we really just think it's worth it to share a lot of this information with. Anything you would add there, Brandi or Erin?
Yeah, I think what I would add is that I feel like this is uncharted territory for a lot of us. And so I think both sides, there's a question of, even with your most trusted relationships, that you're going to see customers asking for as much as they can, and then suppliers and distributors trying to figure out, and obviously there are legal and compliance and competitive issues at stake here, where are you comfortable meeting and how close can we get? And so I do think there's going to be a little bit of that kind of middle space, if you guys can see my hands, of kind of trying to figure it out for a while. Obviously, where you can be more transparent to build that trust, and that's something that is foundational to the second half of this talk, hugely critical. And I think a lot of it is also to understand that, and I would love to hear, providers, this is probably a rich topic of further conversation, but a lot of providers are looking at things categorically and are trying to understand total risk at a category level. So even though it may feel like a lot for an individual supplier to want to know where are your plants, where's your inventory, what's your flex, these providers are trying to look at holistically so that if there's overlap, if there's a natural disaster, if there's a government-related risk, that they have a sense of collective exposure. And so that's why it really is important to understand how each piece fits in as you guys all collectively navigate kind of where are those safer spaces to disclose and provide assurance and mitigate risk together. I also saw an interesting comment about the surprise that I think we shared as well, seeing back in the survey here that clinicians were not more prioritized in terms of the importance for them to reassure them about PPE and to develop the appropriate protocols for reuse. It definitely surprised us. From the conversations that we've had, I would say I think it's more because of a sense of progress already made, and also because there was a sense of COVID brought everybody together in a way. I know a lot of you were having, daily SWAT team meetings and trying to figure out how to disseminate information in new ways. And I think there was a general sense that we were all in this together and that there was less tension overall. And so the collaboration kind of happened as opposed to a place of effort and time and extra initiative. That's come out in a lot more qualitatively through the conversations we've had.
I'd also add on that one that I think some of it also just has to do simply with prioritizing time. So we asked, I think, for the top 3 priorities, top 2 or 3 priorities on that question. So I think as other categories rose up in importance, that clinician engagement fell, which should be interesting to watch as we move out of the crisis, hopefully, or into a new stage at the very least.
Yep. Awesome. So for the sake of time, I'm going to push ahead. I want to make sure that we have time at the end. And again, as you think of them and come across them, feel free to type other questions in. What I'd like to do for the remaining part of our time together is to try and get a little bit deeper into the 5 elements that Erin presented earlier, and a little bit of what we're finding and what we're seeing many of you doing, many other systems doing, many other suppliers and distributors doing to try and move the dial on each of these 5 things. Have we determined the absolute perfect best practice on any of these? Absolutely not. This is all very much a work in process. But I think what really excites us with these 5 is that it does feel that every conversation, our thinking about it gets more refined. We're finding more examples, more nuance to how people are approaching it, and more opportunities, both for all of you to work together, but also more opportunities for analytics and different kinds of platform technologies to help in ways that maybe they haven't been able, we haven't had the tools to do that work before. So in terms of supply chain, the importance of it being moving out of the realm of the operational focus that I think where a lot of perceptions of supply chain have been on the past. And it doesn't mean that operations and logistics are not absolutely fundamental to what all of you do, but that it really is rising to be seen as an element of strategy. And it is both an element of strategy for the provider organization and a fundamental element of strategy for the supplier distributor organization as well. And so this is just a recast of what we had talked about earlier, but again, bringing it front and center that more and more executives are putting supply chain as a top 3 priority going into next year. which is really exciting. I've been at advisory board just shy of 20 years. And this is the first time that I can remember seeing supply chain be that prominent as a strategic pillar for the enterprise. And that supply chain isn't being asked to do this alone, that this is a collaborative enterprise. Again, part of the reason so many SMI participants were invited to bring colleagues to share in this dialogue, that this is even beyond the work of operations and finance, but this is about partnering with the executives, partnering with the clinical leaders, and partnering with strategy, your planning partners, a thing that I don't think gets talked about enough. Really fundamental when we start to talk about demand planning, and this has come up in several recent conversations, the importance of being able to figure out how supply chain fits and can advance the system or the provider organization's broader strategic goals, or the supplier's broader customer service goals, really changing the nature of conversation at that strategy level. A couple examples where we're actually seeing this. I don't know if folks in Dartmouth-Hitchcock are on the line here. Thank you so much for participating in conversations if you are. Obviously, many of you guys have seen the profile, so again, maybe not news, but so important to share this story of what a strategic supply chain organization starts to look like. And no one way of doing it, but that the core elements here really are about leadership, about talent, and about really understanding not even skills and capabilities, but attitudes and competencies, and thinking about that. It's about that system-wide approach and system-wide level initiatives, about partnering across, with all different kinds of executives, and about really kind of, again, aligning at that strategic level. And so you see on the right, just a few of the things that were highlighted in the recent article about Dartmouth-Hitchcock that have come up in our conversations that I imagine several of you are either doing or trying to advance within your own organizations. But the idea of just a mission statement, strategic plan that can become an internal marketing document, so essential. The importance of centralizing core components, be it centralizing systems, SKUs, ways of doing our work, so critical, and obviously challenging, part of a larger piece of work that advisory board does around systemness. I've already mentioned the talent piece, but really fundamental, not just the right people, but the right roles. So much effort here went into role definition and role description so that you have people that can own and advance core initiatives as opposed to it being a side job. And then great collaboration with clinical leaders as well as strategic and operational leaders. And by the way, anybody else who has a story like this that wants to share, we are all ears. The more the merrier here, because I think it really helps to champion when we are talking to folks outside of supply chain, what a strategic supply chain organization can look like in the different forms that it can take. So we are happy to carry that torch for you. But again, really stressing that this is not just about the role of supply chain and provider organizations, but really thinking differently about the role of supply chain at any other level, whether you're a supplier, distributor as well, and making supply chain part of the overall vision and value proposition of customer service. This is one of the suppliers that we work with a lot, and really just shared a great story of how several years ago they went about reframing their core focus on the customer experience. And they thought about the customer experience broadly to include patients, clinicians, health system partners, and really identified several parts of operations and logistics where that was critical to making sure that the clinician had the product they needed for the patient at the right time in the right place. And so supply chain, as you see on the bottom, went about an initiative to really understand where do they need slack capacity? Where do they need to have more inventory based on what customers were telling them about likely demand and where they where there's spikiness. Second, they really figured out different ways for commercial and operations to partner. And so there was two-way communication where commercial was informing supply chain what they were hearing, and supply chain was able to lean in and help serve and support several critical accounts. The result, we have talked to several health systems who really flag the supplier as a true strategic partner, as somebody that's been able to sit down and understand the health system's needs in very different ways, all because I think a very different way that they thought about bringing supply chain to the table in the way that they serve customers. The second element here is adaptive demand planning. And I know several of you were on a recent task force that was looking at this in SMI and came up with, I had the privilege of reading that report with some of the great, very, very tactical insights that you all had. And I think that this is going to continue to be a place where we're going to want to shine the spotlight going forward, because it's really, really hard, as all of you know from your lived experience here. And it's hard for a couple reasons. The first, this hasn't been a place of big investment in the past, especially with health systems. It's enough with EHR optimization and then all these different systems and interoperability challenges. But the supply chain piece maybe hasn't been a big of an analytics focus in the past. And who owns that work? It's one of those, demand planning at the supply level is one of those things that feels like it's a shared responsibility, but very often nobody's single accountability. And so that's why it was really needed at Dartmouth-Hitchcock, where they did define one person whose job it was and was to work on thinking about modeling and monitoring demand for different products. And again, the integration piece I've sort of gotten to already, but this is what makes it really, really hard. But obviously, I think what we saw with COVID and what we're continuing to see with these, the roller coaster ride that we're on with the pandemic, is that this is a problem that's not going away. We're going to need to figure out how to be more agile and look at demand planning, both from a patient volume perspective and from a needed supply perspective, very, very differently going forward. One story that was pretty exciting to us that we heard about how somebody tried to do this a little bit differently was, again, and there's a lot of pseudonyms here, where we saw Delta Health System trying to think differently. And they, like many other organizations, ran short on some critical supplies and COVID. What they did is clinical and supply chain leaders worked together to try and predict when this was going to hit their market. And what's interesting here is they did it with support from the state health agency. So they were really trying to monitor patterns going on outside and what they can learn, and build a really predictive modeling tool here to help and to try and think about it and to try and figure out what were those scenarios and how to be ready for it, and then use those projections to then inform purchasing early enough in the surge that they were able to really get ahead of the problem. And one of the things that's really interesting to us is that, again, this is not just a supply chain problem. This is a collective, how do we plan for the unknown problem that we're finding when we talk to health system planning and strategy leaders alike. And so what really struck us when we were doing this research is how similar the challenges are from a product demand planning as they are from a volume demand planning. And this here is advice that we have been sharing with heads of health system strategy on how we think their own planning systems need to evolve. And they really need to evolve from a very static, annual, almost ritualized process where it's really about informing budgets and investments, and you kind of get to a number. You get to a single future, not as much scenario planning as they might like, but then this becomes like the new guidance of truth. And rather, we're really starting to see more folks take on iterative forecasting. As I joke with a lot of my colleagues, there's really no reason to write anything in pen anymore. Everything feels like it needs to be written in pencil. And so you have rolling forecasts with multiple futures, and then you can kind of figure out within the scenarios what makes most sense to really think again about that contingency plan. Where are you most vulnerable? Where maybe is it worth adding in that extra slack capacity or partnering with someone for some extra warehousing? But this approach, I think, we're going to see more and more working in tandem at both the how do we plan for volumes as well as how do we plan for products, taking a very similar approach to both. Sorry for the sip of water there. And so that's kind of where we're thinking, again, probably a lot more theoretical approach to demand planning than I think a lot of you guys worked on with your task force. And I think both are really important. One is sort of at that level of messaging and process. And then there's the how do we actually make it real that I think your task force and work group really got into. All of that hopefully sets us up to be able to take a very different approach to inventory management. And we use the word integrated here very deliberately, that this inventory management is part of the systemness endeavor and also part of the collaboration endeavor between training partners. That this isn't about just where stuff is stored. This is about rethinking the whole process from purchase to use and even beyond in terms of refurbishment or waste management. It's really thinking holistically about where stuff is, how do we know where it is, how are we using what we need, where we need it, and moving stuff around even as necessary. But first and foremost, as Erin mentioned, we do need larger stockpiles in certain areas. California, where I live, has mandated 45 days supply. I believe New York has brought it up to 90-day supply. And so no surprise that almost all of you are looking to increase stockpiles if you're a provider organization of PPE and of critical supplies. And we are hearing of that then also thinking differently. If you're a distributor, if you're a manufacturer, especially in some of these critical areas, that ripple effect of everybody is then increasing supplies too. The challenge is how best to manage that. And you see some of the quotes that came up in our research on the right, like who has the right capabilities? Who is best equipped to be thinking about those logistics and moving them around? I think some of SMI's participants actually specialize in logistics here. And so there's a lot of question of how much should the health system own itself, where are partners necessary, and where do we put it all? And how do we know it's there? And how do we monitor it? A lot of these questions coming up. I know many folks looking into renting or temporary use of storage facilities or looking to partner with suppliers and distributors on that front.